Please speak to self-medication. People self-medicate.
Hey,
That's the biggest problem we have.
biggest problem in in Liberia. At
Like
least.
I'm like, my mommy, how are you? I'm not well. I'm just coming from the pharmacy now. I went to go and buy malaria medicine. I bought typhoid medicine. I said, you are buying medicine.
Yes.
Who prescribed? How do you know you have? I know it's the
Typhoid, yeah.
feeling. I know the
Yeah.
feeling.
Yeah.
I took antibiotics. I said, mommy, self-medication. It's killing your kidneys and your liver. Oh. Nigerians will never listen to you. That
see-
antibiotic one,
That's what I was
they
gonna
have
you
headache
see-
antibiotic.
Yes.
And I'm sure you people are guilty of the same thing. Tell me.
Liberians and Nigerians, you know how they say, I'm feeling that
amazing.
pain, I'm
Different,
feeling
bro.
that pain behind my back. When I'm sleeping, I feel like I'm going to die. Every idea, like symptoms of stress, they're telling you. And then they say, I think I have typhoid and malaria.
Hi.
And these people they self-administer antimeter. Do you know the antimeter? The amodalquine.
Yeah, I'm the queen.
I took amodalquine and I
That's
passed
the one
out.
that has like
Strong.
itchy.
No,
It
that's
has
the chloroquine.
quinine.
That's chloroquine. The
Chloroquine
quinine.
has that
Yeah,
one, but
I
the
need that drug,
amodalquine, I got burned from self-medicating amodalquine. Because apparently I was too skinny. And now, learning about amodalquine now, for every milligram, you have to be at least 80 kg.
Your weight. It goes by your weight,
Your weight
medication.
is
For
so
every,
important.
for every milligram, you have to be 80 kg.
80 kg. So you have to be at
So that means you need to take like 0.5.
I took 3. I took 3. No, not 3. I don't know what MG, but I don't know what MG it was. I cannot tell you what MG it was, but it was 3 in the pack.
3. That's like 1-1, pretty much.
I took all 3.
Hey.
Apparently, you know they have the little mosquitoes on the backs, and it says 3.
Well, that's a malaria medicine.
Yeah.
It's a queen.
It's a queen.
Yeah, quinine is for malaria.
It has 3, like 3 on the pack, and then it tell you 3, 3, 3. It's now that when I saw for my brother and I read the pack, it said should be prescribed by a doctor, and then
all of
patient weight and to be considered. And pregnancy. My sister-in-law had a spontaneous abortion because of amodalquine.
They use it for abortion. In
We
Nigeria.
didn't know that?
A lot
The
of people
doctor
up to now
malaria
use malaria
medicine.
medicine.
Hold on.
for abortions in Nigeria. That's a different topic now.
That's
Okay,
you don't even want to expose that. But that's something like spontaneously, right away. For me, I passed out. These are 2 different times situation happening, but I passed out and got burned in like a pot of boiling water. Literally, like, why am I taking quinine? And I'm sitting there again. And then this one, ciprofloxacin. Let's talk
T-Bio.
about Cipro. Cipro is one of the mostly sold over-the-counter medication in Liberia and Nigeria. I haven't been to Nigeria. I've had
Don't worry,
enough
Nigeria has
Nigerian
almost all the
stores
medication over
around
the
me.
counter.
Is it antibiotic?
Cipro is an
Ciprofloxacin,
antibiotic.
yes.
Is there any medication that is not over the
So-
counter?
If it's
in
not by the
Nigeria?
counter, you
It's
will know
not-
somebody
it's
that
not
can get
supposed
it
to
for
be,
you.
But in Liberia and Nigeria, it is over the counter. In Mexico too, it's over the counter. I saw it there when I got. So when I got here, a roommate of mine had meningitis. So this roommate had meningitis. We had to call the ambulance that night. When the people came, girl, public health surrounded the house.
Oh, why?
And they put us in this thing. Quarantine, and they like, the public health nurse have to come to see you guys. They'll have to administer a special medication to you, yada 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 yada.
Oh, meningitis is contagious.
So yeah,
Yeah, it is.
yeah, it is. So when this public health comes and wearing all this PPE and and I'm freaking out. I'm like, what did I have? And they give me a little cup with a medication, and then I open the cup and it's like ciprofloxacin. This is a very high-end antibiotic. Take with precaution. I'm
Like what
bro,
you take every day,
I just thought
like candies.
I took 10 Cipros in Africa before I came here. They told me I had typhoid and malaria. And then I got here and there's nothing. So those kind of medications that are exposed, and erythromycin. Erythromycin is one medication that is exposed. People take doxycycline. Doxycycline is not a medication you should take on any kind of stomach unless you're 100% prescribed by a doctor. But these are medications that we self-medicate.
No, but honestly, do
After-
people listen? Because even after you're saying this now,
When you say this, I say people back home or people here.
I mean in general, because it's simple that
Because
that,
remember
that are
that-
back home that are coming here.
Even
though.
it's restricted, right? You can't
No,
really get.
we still send for our
What are you
antibiotics from
saying?
back home.
You are sending. Stop sending.
No,
people
not
to
know what I
me.
mean? Like-
I know people who do that. I don't do that.
I know that when
anymore.
people are coming in,
They
and my
come
friends
with
always
them.
saying, "Oh, you're too Canadian." I'm like, I'm very Nigerian. just that I have more knowledge.
Right.
When they come in, they're bringing this full bag of medications.
Yes.
All the meds in this life is in that bag.
Mm-hmm.
So the next thing you hear them say, "Hey, the bag is inside there. Bring it. Take antibiotic,
yeah.
coffee."
Yeah.
And I want to throw it in the dustbin. I'm like, no, this is drug abuse.
Yeah.
And you're
People cough
killing
to-
yourself, actually. The truth is you're killing yourself.
Yeah.
Antibiotics is not a medication to be taken when you have a headache or when you feel like you are sick, you take Nigerian medication is antibiotic.
Yes. Same with
And you know what?
Nigeria.
It's psychological. You're taking it, you're thinking it's curing you. No, you're
placebo
getting better
effects,
because
yeah.
you're getting better.
Yeah.
It's like when you have a cold here. You don't take medication, you feel like,
yeah.
oh, I need medication, but you need to let it do its thing. Your body's fighting
its
it. You
course.
have your own
Yeah.
system that's working for you.
I have
But
I have
no.
a question though. I had a very interesting stint with antibiotics. I think I was trying to trade like a couple of years ago, before I came to Canada, so it was a while ago, right? So I think they have to always do that test where they see what's your resistance level to different antibiotics is, right?
Oh, MRSA.
Yeah, so like if you want to
I've never heard of that test. They do a
MRSA,
test.
yeah.
so it's
No,
like
so it's
Methicillin,
Resistance.
resistant level. So I think at this point in time, like when I started the test, there was a lot of blockers. Like everything was like highly
Yeah.
resistant, right? And I was like, so what can we now use to actually treat this?
They will look
this
for,
They will
bacteria
find
they will
stuff,
look
right?
for a
for you.
different one
So
and
now my
combine.
question now is, if somebody goes off antibiotics for a while, like 4 or 5 years, and just lets his body do his own thing, will that
Wait.
resistance?
Say that again. If somebody
Like if somebody goes off antibiotics,
like don't take it,
yeah, that's
you
for
die.
a long time. No. Like if you don't take any antibiotic drugs, because there's no reason to take it like over like
Oh,
Yeah,
yeah,
you're,
you shouldn't
you're
take it.
healing
when your
yourself.
body like recover, like build back its like with all those resistance.
I
cells
don't
and
know about
everything
building
die
I
back
out.
don't know
resistance,
about
though.
that.
If
but
it's already
if
there,
you are
I don't know.
Yeah, if you've exposed yourself to antibiotics that you shouldn't, and your body becomes resistive, I'm not
Because
sure.
think
it's
it's
true,
fixed.
like a lot of Nigerians do take antibiotics for a lot of things, right? And I just want to know if like when they like leave, Nigerians is like more like okay, just walk down the counter, go take antibiotics. When they get here and they haven't
They
had
don't
a
have
cause,
access.
yeah, to like does the body like now like heal itself? Like
I don't
try
know
to-
about that. I don't think so. I
The
think
body is miraculous. It has the potential to renew, but it depends to what level damage has been done.
done. Yeah.
So that's why I always bring you back to the checkups.
Yeah, I agree.
So
I agree with
depending
you.
if you're definitely, every one of us are passing around with some kind of resistance to some type of antibiotic.
Number one.
But yes,
Almost
so
everything.
almost sometimes it's on our skin, sometimes it's in our stomach. So we're all having some levels. So if this antibiotic doesn't work, there's always a new brand of antibiotic. Like for me, funny enough, I'm allergic to penicillin,
Me too.
but I take other lines of penicillin like amoxicillin.
So different ones.
So you can be resistive to one, but your body can help work with the other one. So that's the good thing about.
Speaking of-
but that is when you save your body for when it needs it, because when you have exposed your body to all these antibiotics, they're not working for you anymore. They're working against you.
And don't always trust your doctor.
Because those bacteria are strong. They regenerate and come back.
Yes,
Those
they
viruses,
come with full
They
force.
come with full force. They say,
Like
"Oh,
we're
I've
ready
tasted
for
that
you.
before."
So we're here. We're not
That's
going
the thing.
anywhere.
That's why you shouldn't expose yourself to antibiotic, because if you take amoxicillin today and that bad guy in your belly knows that that's amoxicillin, okay, fine, I'll give you a little bit of time.
It reminds me of
And then
something.
tomorrow you come and take erythromycin, you come back and say, oh, yesterday was amoxicillin, today, please, I can deal with that. So then they build more resistance to every single drug you've put in your body. And then they don't fight against what they're supposed to fight against.
Damn.
So when you go to the doctor that you have a cold,
Yeah.
a lot of doctors are lazy.
Yeah.
They're supposed to do a test to see if you have a bacterial infection.
Or viral
They will give you the
infection, yeah.
medication first to go start taking it. They will do the test later. And comes back that you didn't have it. And it happens all
Yeah,
the time.
it happens
At
all
that
the
point in
time,
you've
yeah.
already
Yeah. So
taken,
then
like,
you
Yeah.
a whole
just
batch of
dosing yourself.
Yeah. So you unnecessarily took. They do the same thing with the UTI too.
Yes.
Someone
they will give
has
it to you.
UTI that, so now the Ministry of Health is actually changing that now. So now there are specific symptoms that you have to report. So before someone will say, I have a foul smelling urine or my plain pain in my belly, and then they say antibiotic, UTI. So no. So now you have to have 4 of those symptoms: the burning back pain, the urine,
burning
foul,
urine,
burning urine,
Frequency.
frequency, how much you're peeing, and then the fever. You have to have a fever.
Yeah, the fever is
So the fever is always a marker of how do you call it, infection.
Infection.
Something bad is happening.
When you have a fever, just
Every
know that
time you have a fever, that means something
good
is
thing
not,
to have a fever.
Yeah, it's a